David A. Hall is a CEO at TAMP Inc. TAMP is upskilling doctors in digital health innovation through Digital Innovation Upskilling Programs, engaging patients through digital wellness outreach programs, adopting digital technologies, and innovating digital health. He is a former medical center administrator with 5 years of graduate level work, including a master's in healthcare administration, MHA at Indiana University, and Asian Studies, MA at Harvard Universities, as well as Washington, D.C. Harvard Fellowship in the Office of the Honorable Lee H. Hamilton. David performed several years of additional study in management, information systems, and information technology, MIS IT programs as a project management professional, PMP, with dozens of technical certificates. He has 20 plus years of experience as an innovator in healthcare emerging technologies. David has held Fortune 100 and Fortune 500 management positions, adjunct faculty positions at universities in China, co-founded or helped build at least 10 startups with 2 successful exits. His investment, technology, and consulting firms have worked for years to develop and integrate emerging technologies and have also helped raise tens of millions of dollars for health tech, med tech, and biotech companies, and GMDVA, Global Nonprofit Medical Association Secretary General. Thank you so much, David, for giving your time today for Global Virtual Healthcare Summit. Given your background, I'm sure there's a lot of learning that we will have from your session today.
Thank you very much, Rashmi. It is an honor and privilege to be here. So again, David Hall, CEO at TAMP. Today I'm going to talk a bit about Dr. Innovator's co-designing and co-creating this new innovative digital healthcare ecosystem. And that's really what it's all about. Why? We all know the accelerated growth is accelerating. We have what's called hockey stick growth. It was quoted once that the greatest failure of humans is not grasping the concept of exponential growth. So we really need to gain this mindset, especially in this digital era. We have growth of about $551 billion over the next few years. We have something like 5 million digital health applications downloaded every day. We have about half of the patients who are willing and want to experience digital health technologies, willing to receive digital health care. Most doctors are open to digital healthcare as well. We have something like 350,000 new digital healthcare devices that are out there. So it's nearly impossible to know every single app that's out there, to know everything that's going on. So it's really about developing this ecosystem. As I mentioned, about 65% of patients are open to trying these devices. Many are coming in, we're hearing every day from doctors. Patients are coming in with their own data, BYOD. They know a lot about the wearables that they have. They're beginning to monitor their health on a daily basis. Yet we have a huge gap. We have only about 3% of device recommendations that are coming from hospital doctors, about 6% from general practitioners, family practitioners, etc., and about 2% from nurses. Now, why do we need a sustainable digital health ecosystem? We know the digital giants have tried. They poured billions, literally tens of billions of dollars in kind of a one and done, kind of pushing out the technology. This is the old way. This is the old mindset, from advertising to industry to manufacturing. This is the mindset that you can push out the technology. We take a different approach by developing this ecosystem, incentivizing all of the stakeholders that are involved in building ecosystem with community leaders around the world. According to the United Nations, sustainable development goals are essential to solving the serious pains that we face. If you look at even the word sustainability, one Harvard Business School professor had her students research, could not find anything regarding sustainability for the past 100 years, because again, this is a new mindset. This is a new concept that we need to understand. The local stakeholders being led by doctors better understand the culture, the pains that we have, and can better navigate these environments. Now, doctors have always been innovators. They've always been inventors. As Rashmi mentioned, I started my career at Indiana University Medical Center. I spent a year at Riley Children's Hospital with one of the fathers of pediatric medicine. There was kind of developing back in the 90s shared decision making, where families would come in. It was the first time families could come in and be part of the decision making process. We've had a number of process innovations, device innovations over many years, and we believe doctors. We believe in the curiosity of doctors. We believe in their ingenuity. Now we're developing certified doctor innovators are then able to facilitate the adoption of these technologies. They're able to better engage patients in digital wellness outreach programs, and then to innovate that digital health by co-designing, co-creating with emerging tech partner providers as part of this digital health innovation ecosystem that's led by doctors. Now, how does this all work? How does it begin? There's a 12-week plus 2 program. It's a Digital Innovation Upskilling Program. Doctors can sign up for this, doctors of all specialties, and then we have customized programs in different specialties, such as surgery, digital surgery, for instance. They will download the platform. They have the mobile, any place, anywhere, attendant orientation. Then they will begin participating at either the Explorer level or the Trailblazer level. Now, the Trailblazer level, once completed, will allow access to what we call the pathways. So the pathways are part of this sustainable ecosystem where doctors can then choose to become a co-facilitator themselves to offer these programs in their region, in their country, to then continue to build this ecosystem. They can become a knowledge transfer advisor, take part in an additional advanced program to become an advisor in the digital wellness outreach program. This is, again, building awareness with patients. So doctors and patients working together to adopt these technologies, or they can design and innovate what we call DPPC. This is design, plan, pitch, and connect in our Innova Hub. Now, what are the core competencies? Everybody's been trying to figure this out for many years, not only in healthcare, in many industries. What are the digital skills that doctors need? Now, when we first mentioned this a few years ago, most people would think, okay, you must be training doctors in digital skills like entering medical records data or something like this. So they're thinking of one specific application, one specific skill. In this digital world, again, with the acceleration, we require core competencies we've been working on for 5-6 years, even prior to this, of innovative mindsets such as flow. This goes all the way back to Harvard again, William James, back a century ago. Then to someone else that worked on flow, this idea of being in the zone, the Csikszentmihalyi. And then more recently, my friend Stephen Kotler, New York Times best-selling author. Now, we felt this was very important to build the foundation first. Synergy, which is versus hierarchy, is about collaboration. It's about communication. Now, this applies, whether you're a surgeon, whether you're a medical doctor, any type of healthcare professional, before consultation, before surgery, during consultation or surgery, and then post. So the synergy, collaboration, communication, very important, even for enhanced recovery, ERAS. preparing before surgery, and then continuing monitoring smart devices, things like this after surgery. So this is the synergy, teamwork, and then exponential thinking, which is very, very important. The 6 Ds of exponential thinking: demonetization, disruption, making things smaller, making things dematerialized, making things less expensive and more accessible, democratizing them around the world. And then module 2, which is the human-centered digital health literacy. It's about the human first. So human-machine interaction. We want to focus on the design. We want to focus on the human aspect. And then module 3 is digital technology applications. These are real-world applications in extended reality, AI, artificial intelligence, Internet of Things, wearables, blockchain, 3D printing, and then working towards one final action-based proposal where teams of doctors are working together towards these final action-based proposals. Now, I'm going to share a bit more here about the mindsets. So you can see a bit about what we're offering in this program, the flow, the synergy, and the exponential thinking. Again, it's very important to build a strong foundation. We're continuously building throughout the program and then into the pathways. We're recombining, we're synthesizing what has been experienced. It's all about experience. It's all about action-based, human-centered digital health literacy. Doctors literally walking through their own design, the customer journey map, the patient experience or customer experience, we call CX or PX, that needs to be designed now. It's required, it's expected, and we're creating future value based on, in the US, value-based healthcare and the idea of creating value. Now, we knew that this needed to be immediately applicable. Doctors trust other doctors. We have doctors sharing via doc live streaming video, their real-world applications and real-world experiences that are immediately applicable by other doctors. So they want to know, what's trusted, what's safe, what's secure. A lot of questions about what's being used, and again, we have 350,000 apps out there. What's really effective? What are doctors using to improve patient care delivery and outcomes? So this is key. This is very important. And then the action-based proposal. Everyone learns better. Everyone experiences better with an experiential process, a program. They have curiosity, more aware. So it's very important to have a hands-on, action-based proposal where you can get in there. We use crazy eights, we use ideation, we're coming up with ideas, we're solving, proposing problems, writing problem statements, interviewing doctors, interviewing surgeons and others, sketching them out very quickly. Design has what we call a bias towards action. So you want to sketch something out, you want to get it in front of the users, you want to get feedback immediately because time is of the essence. We're developing, again, this new innovative digital healthcare ecosystem. We like to call it a mega project. We had a webinar yesterday on healthcare singularity and mega projects. So again, we like to kind of zoom out, zoom in. Sometimes we are zooming out to space, literally with maybe the space station. My colleague, Dr. Al Ansari, will talk about this after me. And so we are kind of zooming out, and then we're zooming in, making it very practical as part of this ecosystem. So again, I will finish with Dr. Innovators leading the way. We believe in the ingenuity, we believe in the creativity of doctors to design new innovations to solve their own serious pains in healthcare. So thank you very much. Feel free to connect with me on WhatsApp. You can Google us. You'll see us out there on just about every network under TAMP, T-A-M-P, or AMP Doctor, A-M-P, D-R. Thank you very much, and I'll open up for questions if we still have some time.
Thank you so much, David. Yeah, we do actually have some good amount of time. So Yeah, we'll use this time to kind of wait for questions from the audience. So audience, if you have any questions, we'll take 2 minutes for you to type in your questions for David. So David, one question that we have is under the DIUP program, how many doctors have been a part of it already? And is there a specific criteria to be a part of DIUP program?
Yeah, very good question. We have both programs for all medical specialties, and then we have special programs for surgical specialties. One called the HTC, we developed with the High Tech Surgery Association. It's called the HTC DIUP Digital Surgery Program. Again, we are always customizing and working with medical associations, with societies, with academies, to co-develop based on our foundation, based on our framework, the models and approaches. So if you have also associations, if you have societies, I wanted to mention, we work with the leadership, we work with the presidents, we become their kind of their outsourced medical education department in digital health upskilling. So we can work with cardiology. We're co-developing a new program for primary care, for family practice. So this is open to any medical doctor or equivalent, country equivalent throughout the world. We had in our previous cohort, we had 57 surgeons in the digital surgery program from 31 different countries that joined. Some were certified at the Trailblazer level and some at the Explorer level. So again, these programs, Explorer level, takes about, you want to commit about an hour, at least an hour a week. For the Trailblazer level, you're going to commit at least about 3 hours a week. And the next cohorts are forming for January and February. We're having a kind of a year-end holiday discount. We offer 50% off right now. It's been heavily subsidized by a nonprofit medical association. And then we also offer purchasing price parity, PPP, based on the index, which is in underserved developing areas, we can offer additional discounts because we want to make this affordable, accessible, and available to doctors of all specialties in every region of the world. So great question. Thank you for asking. I hope that answered your question. Then the next cohort will begin. You can sign up now on the AMP-Doctor, THEAMP, make sure DR, theampdoctor.com. And those programs will begin in January and February of next year. We'll offer the year-end discount if you get in before the end of December.
Thank you so much, David. That is a very helpful information. I think that's all the questions we have right now.
Thank you. Wonderful.
Thank you so much, David, for your time. I think if there is more questions, David, we will put it across to you through email.
Okay, wonderful. Thank you, everyone. It's been an honor.
Thank you. Thank you so much, David.